Our next speaker is Dr. Anton Plaksichuk. Anton is an orthopedic surgeon. As we mentioned, orthopedic surgeons are the side of the balance with rheumatologists in treating joint arthritis. And surprisingly, as we heard, orthopedic surgeons, although we are surgeons, we actually do provide sort of a complete care, meaning the majority of patients that come into our offices don't require surgery. There are in-between steps, and sometimes, believe it or not, people come in and think they have hip or knee arthritis, and they don't even have it, and it may be their back. So we are in the role of trying to direct people, as Terry mentioned, to try to educate people as well. But when it comes time, when the pain is too great, it affects your activities, there's nothing, you've tried everything else, many times it is time for surgery. The decision for that, though, is yours. And the reason we're here today and what Anton's going to do is just to educate you on what are the surgical options when it comes time for you to think about taking the next step. Anton?
Good morning, everybody. This is a unique opportunity for me, and I appreciate Tony inviting me to speak today. I see 40, 45 patients a day in the office, but this is just a great auditorium, great chance to talk to everybody at the same time. And I don't have much experience with it because, we speak at medical conferences, and it's actually a challenge for me to prepare this talk. Hopefully, I'll give you and show the options, and you'll understand me what I'm trying to say. And let's proceed. And again, just repeating things that United States has an aging population, and 33 million of people older than 65-year-old, and it's 13% of the population right now, and it will be 20% by year of 2030. And again, we have slightly different numbers, but osteoarthritis is incredibly widespread disease, and it's extremely expensive to the economy. And the most we talk prior to this conference, and osteoarthritis is not a threat to a life, but a threat to the lifestyle. It basically make you change your lifestyle, and this is what the worst part of this disease, that you can't do the things what you're able to do a month ago, a year ago, and this is how you go about the surgery and how you decide what's going on in your life and how it affects you, and what you can do to get back in shape where you've been a year ago, or maybe even longer. Our goal is, we have many different speakers and we have different tasks, and as a surgeons we have to give you options, what we can do for you in order to make you active as possible. And a lot of people asking what is too young for knee replacement, hip replacement, what is too old, and there is no right answer. Each of us are very, very different. We have different activity level. Some people still run marathons at old age. Some people want to go to just go and shop in the mall. And every patient has to be looked at in separately and as a person. But the whole goal is basically to be as active as possible and keep your expectations. And just speeding up to the surgical part of my talk, again, Dr. Stars just did a very great talk about what's going on in the joint. And then basically your cartilage get affected, your synovial lining get affected, and it's all makes you joint stiff and painful when you move. And we work mostly with a knee and a hip. We can also we have replacement for shoulder. We have replacement for small bones in the foot. It's extremely large topic, but basically this is how your knee look inside. has ligaments, has meniscus that basically plays a role of a cushion, and the cartilage is the most important part of your joint, which you just saw in the previous talk. The hip anatomy, everybody shows you the knee slides. This is how your hip joint look, and it's very different. It's like a ball in the socket joint, and it has this so-called labrum, which is basically like a meniscus in the knee, but it plays a very important role in your hip because it keeps the fluid, keeps the pressure inside of your joint, so you can always have some synovial fluid between your cartilages to disperse the pressure when you make every step. And this is MRI that shows how this look. This is a MR arthrogram. Basically, they put the contrast in the hip in order to see the anatomy better. And in the last 5 years, those studies becoming very advanced, and we can see the small details of the hip anatomy. And if you can see on the bottom picture here, this is the same labrum we're talking about, and it's like a little seal that keeps the fluid inside of your joint. So one of the theories, this is what prevents wearing of cartilage, and you will see in my surgical options later why we think it's important. And this is in the corner of the slide. You can see the arthroscopic movies. This is one of the type of surgeries we do that now with modern equipment, which is through tiny little incision, we can get a camera inside the joint, and we're able to see. It's a lot of moving around because it's very deep in the body, but this is how the labrum look like, and it's a cartilage and it's a femoral head. It's a very, very tight space, but this is what and you can see some, before you saw it on diagrams, but right here it's a torn piece of cartilage, which basically irritates the joint, or it has to be trimmed back or fixed down. It's down to the acetabulum. It's many different options, but it's as time progresses, we have more and more understanding how the arthritis develops, and this is one of the probably reasons for arthritis. And again, to show you the knee X-rays, this is a normal knee, and you can see how wide the space is, and all these black lines that correspond to the cartilage we can't see on X-ray. So this would be the end stage of the arthritis when there is no cartilage left, and there is many variants between. So it's why you go to the doctor and he decides what's the best treatment for you, for your knee. And it's truly come to the surgery at some point. And my goal of this talk is to give you different options on surgical treatment. And as I will talk about arthroscopy, debridement, we can do the osteotomy, we can do partial replacements, we can do total joint replacements. And basically, there is different stages where you could be in this process. So probably the earliest stage is when you just torn your cartilage, and the joint is still relatively intact, and there is something wrong with the knee or the hip or the shoulder, and there is little hole in the cartilage. So at this time, the arthroscopy is a viable option. So basically, it's available for the knee, available for the hip. It has a diagnostic value. It's viable option for young patients with short duration of symptoms and no arthritis, or let's say mild arthritis. So you can see on the bottom, this is a hip arthroscopy, one of my surgeries when we fixing this cartilage that was torn. Remember I showed in the previous slides, we were able to, with a suture and